Welcome back to Investments for Impact, Wambui.
Thank you, Moses.
Yeah, it's been a while since you were here.
Yes, it's great to be back.
So, for the sake of our guests, could you please reintroduce yourself?
Happy to do that. My name is Wambui Gachiengo Nyabero. I'm a biomedical engineer with a background in mechanical engineering as well as manufacturing systems engineering. I've worked most of my career with medical devices. Started out in the US, working for a company called St. Jude Medical that, I was in the cardiac rhythm division where we were developing pacemakers and defibrillators and other things for the cardiac space. I was there for 10 years and worked across the spectrum of MedTech, all the way from early research to development to manufacturing and a lot more. After which I did a stint working on my own startups. I was developing a couple of devices. I developed a screening or diagnostic tool for sickle cell disease, and then one for peripheral neuropathy in diabetics.
Wow. That's very impressive.
Thank you.
Yeah. So, how did you end up in MedTech, Wambui, especially considering that there are not too many women in MedTech now, in the present, and I guess even back then in the past when you went to college.
In the dark ages.
There were probably fewer women still.
Yeah.
So if you could just track back a bit, how did you end up in this space?
Yeah, it's actually a bit of an interesting story, and it highlights how important good teachers are. Mm-hmm. When I was in university, I was in the mechanical engineering program, and I took a class that was about developing medical technology, and I got hooked. So in this class, there were things there that were very scary. So we had to do needs finding, and I was working on a project to develop something for back surgery. So I actually had to go and watch back surgery to really understand what it felt like for the surgeon who was doing the surgery. And I tell you, I almost passed out. But after I developed this surgical device, in a team, I just thought, what a useful thing, a useful place to work, where you're actually developing things that can improve the quality of life and even maybe save lives.
Thank you. So this season of the podcast is focused on MedTech, and it's in the run-up to the Transforming Africa MedTech Conference. Could you talk a bit about that?
Absolutely. I'm really excited about this year's Transforming Africa MedTech Conference, which will be on August 28th through the 30th of this year, 2024. And, when I look back and reflect on the last year's conference, where, we had about 120 people coming from 14 different countries, and mostly from across Africa, it was so powerful to have all these people from across the continent who are working in their own spheres and are experts in their fields in MedTech. And this year, we really want to extend that, bring in people from beyond the African continent, but even go deeper into the experts on the continent so that we can really go into some detail about what is working well in different places. So can we replicate that? What do we need to get even better so that we can actually grow the medtech industry across the continent? I know, it's a big vision, but with every journey, you just start with a step or two. And the step this year is really to bring more people and talk some more about what are the actions that we can take, both locally and globally, to support this industry.
Excellent. I'm really, really looking forward to this season of the podcast because we're going to co-host it together.
Yes.
But then now, maybe we can start to speak a bit about the context. And if you could tell us, how does the landscape of medtech manufacturing in Africa look like? What's available, what's not there, and where do you think we're heading?
So there are two things. There isn't enough, and there also isn't enough information about what's available. So part of why we decided to convene with the Transforming Africa MedTech Conference is so that we could actually understand what that landscape looked like by bringing people together and talking amongst each other. So the information is thin, and the resource, the manufacturing resource, is also very thin. So what that does, and don't get me wrong, there are some amazing examples of medtech manufacturing on the continent. To mention just two, there's Revito Healthcare in Kilifi in Kenya, and then there's Sinapi Biomedical in South Africa. Both are really great examples of medtech manufacturing in Africa. But I keep saying what we need is another 24 Revitals and Sinapis across the continent.
Excellent. So that brings us to the next question, which is, why has medtech lagged behind in Africa? There are a lot of manufacturing industries across the continent. We have a lot of automobile assembly and manufacturing. We have pharmaceutical manufacturing. But why has medtech specifically lagged behind?
I think part of it is that we haven't very intentionally stopped and thought that we could produce our own medtech. I mean, there's been pockets of that. And, South Africa is a bit ahead. But we have not been very intentional about figuring out how to, or even thinking that we should do that, right? Because we are getting medical devices and equipment from the big corporations in the global north, and also from China and the rest of Asia. And so that's one thing. I think the second thing is that the ecosystem is not sufficiently developed. And what I mean by that is from a regulatory perspective, because this is a very highly regulated, rightly so, highly regulated industry. You can't just develop and put a medical device on the market. It has to go through oftentimes clinical studies, and it has to go through a regulatory process and get approved before you put it in the market. And then you have to keep tracking it while it's in the market. Those systems are not as well developed here as they are in the global north and in places like China. So these are the things that need to happen so that we can catch up with other industries like the automobile, like you mentioned.
And why is it important for us to manufacture and develop medtech for ourselves, given that we do have products coming from the global north and from the east?
I would say there are a couple of different reasons. From the obvious, that if we are developing our own products, they're very customized to our needs. So both from a patient care perspective, but also from an infrastructure perspective and anything else that you need to make sure that these are working. There are stories I've heard about equipment that comes all the way from the US or Europe and gets to the hospital and cannot be used because we didn't think about the fact that it needs to be in a shielded room, for example, or that it needs a certain power, or, and you have to get a new transformer, and then the costs keep going up. And, oh, by the way, you don't have anyone who can service and maintain this equipment. So that's one piece. I think the other piece is that it would be a great economic driver on the continent because anytime that you're building an industry, especially manufacturing, you're going to need people. You're going to be getting investment coming in. And I think that can only be a good thing in terms of developing an economic powerhouse, honestly.
Yeah, thanks, Wambui, for sharing that. I particularly like the point around developing devices to treat our diseases. To what extent is that a problem, that we have untreated conditions as a result of lacking development for diseases that speak to our problems?
So I really don't have numbers, so I can't tell you what the numbers are, but I can tell you a couple of stories.
Please.
So, for example, due to the fact that we have more melanin than, in many parts of the world,
Yes.
there are things like, imaging solutions that it is not clear whether they are calibrated to work well with our skin, right? So my concern, and I do worry about it, is that when we get devices and equipment that are coming from a place where they were tested on people with less melanin, are they actually doing what they need to do? And I'm not trying to be a conspiracy theorist or anything, but I worry about things like that. An example with a company called A-Light from Uganda, they are working on a device to view veins so that doctors can easily cannulate or draw blood from young children. Actually, can probably be used on adults. But what you find is that if that device were calibrated for a very light skin pigmentation, you may not be able to see those veins when you move to someone with a lot of skin pigmentation. So they have dialed it in so that it actually works for us on the continent.
Thank you. And going back to the manufacturers themselves, what kind of challenges and opportunities would you say they face?
There are both opportunities and quite a few challenges. And I'll start with the challenges so that I can end on a high note. Because the supply chain, the inputs that are going into the devices and equipment are coming from across the world. And I'll say a little bit more about that later. But it becomes very expensive and difficult to compete with the same people that are giving you the inputs that are also making competitive devices. Yeah, so you end up with devices and equipment that you cannot price to compete with, say, devices and equipment coming from China. So that's a challenge, and that's a big challenge. The opportunity there is that a lot of the natural resources, the minerals that go into those components, come from the African continent. Yes. And I really feel like if we start having that industry locally within the continent, then we can start vertically integrating and starting to use those natural resources to really be very competitive. Because if we are creating our own inputs, then we should be able to get to a point where the devices and equipment that we are developing are so competitive that we can even export them to the rest of the world. So that's one thing.
Maybe if I could interrupt you before you continue.
Yes.
So where do we start? Do we start with the components and then work our way to the devices, or do we start with the devices and hopefully imagine that it will lead and spur the production of components?
It sounds like the chicken and egg question. Huh?
Precisely, yeah.
Yeah, but I think honestly that we start with the assembly and manufacturing of devices, because as we are building our expertise, I think we should start at a place where it's the easier place, where the barriers to entry are a little bit smaller. So if we started with assembling devices and then we grow that expertise, and part of the expertise that we would be growing is how to build a high quality medical device, not necessarily from scratch, but to assemble it. And how do you do all of that documentation? Because that is yet another challenge, is the whole quality management systems. Now, those we kind of have figured out in the pharmaceutical industry, because we do have pharmaceuticals that we are manufacturing locally, on the continent and also locally in Kenya. And so really understanding how to use quality management systems for medical devices is a big part. And once we've got that, then we can start slowly vertically integrating and get to the point where we can build those components, those building blocks that will give us good devices.
Thank you. I really like that response, because it provides us with a practical starting point that we can then launch from to develop an industry.
Exactly.
So having spoken about the challenges and opportunities, what would you say is the role of the Transforming Africa MedTech Conference in helping us to capitalize on the opportunities while addressing the challenges?
So, I started talking about some of the challenges, but there are many across the value chain of medical device. I talked about the supply chain. I've talked a little bit about the regulatory framework, but then there's also things like market access and barriers to market across the continent. Because if you think about the African continent, the market is huge, but each of the countries on the continent have their own barriers, their own customs, their own tariffs and taxes. And having that kind of a fragmented market makes it difficult for somebody who is developing a device, say, in Kenya, to sell it across the rest of the continent. What the Transforming Africa MedTech Conference is going to do is bring people together such that we can start thinking about action planning to solve some of these challenges. How do we talk with governments in terms of policy so that we can reduce some of those barriers, whether they are tax barriers or non-tariff barriers across the continent, so that we can successfully have a sustainable industry? How do we work with the AU and the African Medicines Agency to really develop a regulatory environment that works well for local developers and manufacturers? How do we start thinking about the supply chain and how, whether we are bringing components from outside or we're developing them and manufacturing them locally, how can we have some kind of protections for the enterprises and the manufacturers on the continent? How do we make sure that the governments, different governments across Africa, are procuring locally developed and manufactured devices before they procure those from outside? So
what are the sectors you're targeting for the conference? Who are some of the people we can expect will be attending the conference?
Honestly, the first thing is, are you an enthusiast? Do you love medtech, right? What we are really hoping is to have a very broad set of experts. So from academia, people who are actually training biomedical engineers and doing research in the space, through people who are actively innovating and manufacturing, people in government positions we really want to engage with regulators, with people in procurement, people who are who are doing the strategy for healthcare in African countries, so that we can really start having deep conversations about how do we end to end plan for growing this medtech industry so that not only are we innovating, but it's going all the way to procurement and actually to end of life. What do we do with these devices when they get to end of life? How do we, especially when we're talking about electronics and potentially, do we recycle them? What does it look like so that we don't end up with different graveyards? I mean, right now, we just have graveyards of medical equipment because it's not the right equipment. But if we're not careful and we don't plan well, we'll end up with the same situation, even when we have our own devices and equipment.
Thank you. You were talking about the kinds of people we can expect at the conference. Will we also see the actual innovators? And who are some of them? Could you just speak a bit to the kind of innovators we expect will be at the conference?
So what the hope is, and this is what happened last year, is that we'll have innovators from very early stage innovators, people who are still students in university, who are coming up with brilliant medtech, all the way to people who are already manufacturing medical devices and equipment and selling them. So examples on the end of people who are already very successful, I had mentioned Revita Healthcare and Sinapi in South Africa. We also have locally people like Drop Access who have, I believe at last count, over 40 or 50 medical fridges that are already in the market. When it comes to earlier stage innovations and entrepreneurs, we do have, and last year we had several people from all over the continent. We had a couple of gentlemen from West Africa, one from Ghana and one from Cameroon, who is actually working on screening for cervical cancer. We have from Tanzania several products that are being developed under the auspices of the PDP and Ifakara Innovation Hub, some of which are things like bubble CPAP for young children to help with oxygenation, things like dental crowns that will be 3D printed, and just amazing innovations that are early stage, but getting to a point where we have line of sight of getting them into clinical studies and getting them into the market.
Thank you. So you talked about targeting different players in the ecosystem, such as government officials who might be involved in the regulatory pathway. You talked about bringing in innovators from early stage to late stage and mature. I'm wondering, though, are there any kinds of participants that you would want this year that you didn't have last year in the conference?
Absolutely. So I think a big gap that we felt in the conference in 2023 was a lack of government players. So we had a couple, I believe, from Malawi, and we had regulators from both Mauritius and South Africa. But what would be really useful would be to start having these conversations both at the Pan-African level, so with the AU and other continental bodies, but also individual governments that can start coming together and talking about how do we break down some of the barriers, that I talked about, whether that's in terms of market access or regulation or any other barriers that are identified as we have these conversations.
So what about the global perspective? Why should players from outside of Africa pay attention to this conference, in your opinion?
I think it has a lot to do with the supply chain. Actually, two things. The supply chain is one, because if you remember, whenever there is something that's happening in the world, like COVID-19, for example,
Yes.
or the war in Ukraine, supply chains are greatly affected. So there are many people who were very affected in terms of getting either components or devices out of China during COVID-19. And similarly with the war in Ukraine, we did have very disrupted supply chains. So that is, looking at Africa as potentially another place where we could do manufacturing, that could be a very viable part of the supply chain, is one of the reasons. The other is that if we're not taking care of our health needs in Africa, it's going to affect everyone globally. COVID-19 again is a very good example for how pandemics and epidemics can start in one place and yet affect the whole world. So I think it is in everyone's interests to grow this industry and have Africa be self-sustaining and even more have the ability to manufacture for the rest of the world.
There is one group that is conspicuously absent from the groups you've mentioned, and that's investors. And given that you're targeting a global audience, what would you say are the opportunities for investors?
In the same way that I just talked about the rest of the world potentially being able to rely on the African continent for their supplies, I think that whichever investors come to this space first are, I think, going to have a very good return on investment. It does need very patient capital. So I think it needs to be sort of a coalition of investment all the way from development finance through impact investing and as well as venture capital, so that we can really figure out what is the way that we can create financing or investment that will work for this space that takes a while to get products out.
Thank you. So when you think about the future of medtech manufacturing in Africa, what comes to mind, and what kind of role do you see the conference taking in shaping that future?
I see a very vibrant future. I really do see this as an industry that can be very powerful in many ways. One, in solving some of our healthcare issues on the continent, because without health you really have nothing, and so we really need to put a lot of emphasis on figuring out our healthcare needs. Second, like I said, it can be a big employer. Jobs is a big point of contention on the African continent. We have a lot of young people who don't necessarily have employment, and skilling them so that they are able to be part of a medtech industry, I think is really exciting, and I see it as not the answer, but one of the answers for improving the economic situation.
So finally, if you could tell our audience how to get involved in the conference. If I'm watching and I'd like to participate, what would you say to me?
There are many ways that you can participate. The first, and we are still fundraising. So one of the things, especially with people who have CSR budget or foundations out there, is to provide sponsorship so that people who are not able to come to the conference are able to do so. Two is just get in touch with us and let us know if you have something that you'd like to add to the agenda. We are currently co-creating the agenda. We would love to have many different voices. I don't want this to end up being an echo chamber where, we are just saying the same thing. So we want to hear the different perspectives from across the globe on how we can do this right. And then just come, participate, and become an active member of the community that's trying to build a very vibrant medtech ecosystem.
Thank you very much, Wambui, for your time and for your wonderful insights. Looking forward to the rest of the season.
It's been a pleasure, and we have some amazing guests coming up, so I'm
Yes,
really
we do.
excited to have those conversations.
Yeah. Thank you.
Thank you.